Hi guys and welcome to my channel. Myself Dr. Akshay, and in today's session I'm going to be discussing about the topic how venous valve incompetence can cause varicose veins. If you guys want to learn more about the circulatory system, then click subscribe and the bell icon. So let's do this together. So before going to the topic, I would like to give a small introduction regarding the concept. What do you mean by venous valve? So the venous valves, they are flap-like structures, and these are present inside the veins. So these flap-like structures, which are known as venous valves, these are derived from the endothelial layer which are present inside the veins. So here you can see this is the endothelial layer. So from this innermost layer, that is this endothelial layer, these venous valves are originated. So what are those functions of these venous valves? These venous valves prevent the backflow of blood. These venous valves allows for unidirectional transport of blood. That is, from the lowermost bottom of the body towards the heart. These venous valves always transport blood against the gravitational force. So how does these venous valves function? Here, when we are walking or running, our skeletal muscles contracts and relaxes. So when skeletal muscle contracts, the skeletal muscle squeezes the veins. This squeezing of veins results in sudden opening of these valves. This sudden opening of these valves results in the flow of blood towards this particular area. For example, again, after contraction, the skeletal muscles will relax, and the relaxing of these skeletal muscles results in closing of these valves. So what will happen? This closing of these valves results in preventing the backflow from this particular area towards this particular area. So imagine a person is walking. So first, his muscle got contracted, and that contraction of muscle squeezed this particular vein. So what happened? These venous valves get opened, resulting in flow of blood from this particular portion towards this particular portion. Also, the skeletal muscles will relax, and this relaxing of skeletal muscles resulted in closure of this particular valve. So what happened? The blood which has been passed from this portion towards this portion will not flow backwards because these valves got closed. So through these mechanisms, this venous valve functions. So coming to the topic, how venous valve incompetence can cause varicose veins. So the valves of venous system, which we have already discussed here, may become incompetent or can be destroyed. This can be due to overstretching of veins by excess pressure, which can be lasting weeks or even months. This can occur in pregnancy. Here in pregnancy, the pressure in the abdomen increases, and this increased abdominal pressure can increase the pressure in these both lower limbs. If pressure in both lower limbs increase, then venous valve incompetence can occur. Or if a person stands for longer periods of time, in this case also, the pressure in the lower limbs increase. This can also lead to venous valve incompetence. So, see this figure. This is the normal vein, whereas this is a varicose vein. Here in normal vein, the veins are not stretched, whereas in varicose vein, the veins are stretched. And you can see increased diameter while comparing with this normal vein. So in this varicose vein, as stretching of valves increases, the diameter of the veins will increase. So with the increase in diameter of veins, these valves or the leaflets will not change. It will remain in its initial measurement. So when this occurs, these leaflets will not close completely. As pressure in the veins of the leg increases greatly because of the failure of this pump, this further increases the size of the veins and thus destroying the functioning of the valves entirely. Thus the person develops varicose veins, and this is characterized by large bulbous protrusions which are present just beneath the skin, particularly in the lower leg. When people with varicose veins stand for more than few minutes, his venous and capillary pressures will become very high, and thus leakage of fluid from this capillary causes constant edema in the legs. This edema in turn prevents the diffusion of nutritional substances from the capillaries towards the muscle tissues and skin cells. So imagine if muscle tissues are not getting proper nutrients, means these muscles will become more painful and they will lose their strength. And similarly, if the skin cells are not getting proper nutrition, means the skin cells will become gangrenous and ulcerated. So tight binders or long compression stockings can help to prevent edema and its further complications. And there is also one yogic posture which is mentioned for patients with varicose veins. So that yogic posture is Viparita Kairini Yoga. So you can see this is that posture. So first the patient should be made to lie down. Here the hips of the patient should be made to lie against the wall. And slowly he should uplift both legs like this. And his both hands should be in relaxed position, like palms and inner elbow facing upwards. So both legs should be made to lie against the wall, and these legs should be kept relaxed, and the patient should breathe normally. So this posture should look like L shape, and here this patient can prolong this posture as long as he wish. So that covers the topic how venous valve incompetence can cause varicose veins. I hope you guys learned about this particular topic. Thank you so much guys. See you guys in the next session.